Oh, yeah, sure.
The sun is out, the birds are chirping, and minds are about to be blown. Hey, what are you so focused on?
I'm learning about 1 minute preceptor.
1 minute preceptor? Are you kidding? You can't precept in 1 minute. I mean, precepting is a lot of work. You never leave on time, there's no lunch break. Oh, and you always have to drag information out of the students. Sometimes they just sit there and stare. Nope, not for me.
Well, 1 minute preceptor is a great tool. You're right, though, you can't really precept in 1 minute, but it does let me teach on the fly. Now I'm able to juggle a busy clinic day while also doing something I really enjoy, which is teaching. The best part is that you get a good idea of a student's clinical reasoning skills, and they sort out solving the problem, maybe with a little help.
This sounds really complicated. Like we're gonna need plus and...
No, here's how it works. Step 1, get a commitment. You want the student to commit to the most likely diagnosis, as well as a few differentials, including any can't-miss diagnoses.
Okay, let's take this for a test drive. So I just saw a 36-year-old guy with a cough for over 2 weeks. He says it's been a dry cough. He denied any shortness of breath, chest pain, or fevers. There was a little nasal congestion at the beginning, but that's gone. And otherwise, his review of symptoms was pretty unremarkable. Oh yeah, he doesn't smoke. So overall, his physical exam was benign. You know, the normal blah, blah, blah.
Great. So what do you think is going on with this patient?
Well, maybe he needs a good... Yeah.
Really?
Okay, alright. Seriously. That was cool. Okay, well, my first is bronchitis. Oh, but I was also considering allergies, or maybe he just has a cold?
Okay. Well, you certainly have some good thoughts. Now, tell me why you think he has bronchitis.
Well, his cough has been dry, and he has no fever or tachycardia. Plus, his lungs sounded great.
That sounds reasonable. But why didn't you think it was allergies?
Easy. No sneezing, watery, red or irritated eyes.
Excellent. But had you considered asthma in your differential?
Dang, I forgot all about that one.
That's okay. Right or wrong, I needed you to commit to a diagnosis. And then I was able to probe for supporting evidence. And that is the second step.
Whoa, that was pretty slick. You saved a lot of time by going right to the heart of all of it.
Exactly. And by probing for supporting evidence, I was able to quickly get insight into your clinical reasoning and identify gaps in your knowledge.
Yeah, so cool. What's next?
The third step is to teach general rules. Remember, you don't always have to wheeze to have asthma. The initial cold symptoms may have caused an exacerbation of the asthma, and now the cough is the defining symptom.
I totally see it. Plus, this is a great time to drop a clinical pearl or two. Is there more?
Yep, just 2 final steps. Step 4. We want to reinforce what was right. In this case, I might tell you that you gave a concise and organized presentation and considered some very reasonable differentials. Really? Again with the applause? And now the last step, step 5. This is basically correcting mistakes. In your example, I would point out that remembering to ask about a past medical history of wheezing or asthma could have really helped you out.
This is really great. I mean, it takes more than a minute, but it's quick and effective, and you can really understand a student's thinking. Okay, so let me run through this from the top. First, get a commitment. Next, probe for supporting evidence. Third, teach general principles. Then, we need to reinforce what was done right. And last, we need to correct mistakes.